Varicocele is a common condition where the veins within the scrotum become enlarged, leading to swelling and increased blood flow. It primarily affects the testicles and is most commonly found in young men, often during adolescence or early adulthood. Varicocele can cause discomfort, fertility problems, and, in some cases, testicular atrophy. While it is generally benign, it can have significant implications for male reproductive health and overall well-being. Understanding its causes, pathophysiology, symptoms, diagnosis, and treatment options is essential for effective management. Causes of varicocele. Varicocele occurs when the veins in the pampiniform plexus, a network of veins located in the scrotum, become dilated. Several factors contribute to the development of varicocele. 1. Impaired venous drainage. The most common cause is an issue with the venous drainage from the testes. Normally, blood flows from the testicles to the heart via veins, but a malfunctioning valve can cause blood to pool in the veins of the scrotum, leading to varicocele. 2. Left-sided predominance. Varicocele is more commonly found on the left side due to the anatomy of the venous system. The left testicular vein drains into the left renal vein at a right angle, which can result in higher pressure and impaired venous return. Anatomical factors. Some individuals may have abnormal or weak vein walls, making them more prone to varicocele. 4. Hormonal changes. Imbalances in hormones that regulate blood flow can also contribute to varicocele formation. Pathophysiology. The pathophysiology of varicocele is characterized by the enlargement and dilation of the veins within the pampiniform plexus, which is responsible for draining blood from the testicles. The process begins when the venous valves within the veins fail to close properly, resulting in the backward flow, reflux, of blood. This increases venous pressure, causing the veins to dilate and become engorged. The increased venous pressure impairs the normal function of the testicles by raising the scrotal temperature. This elevated temperature can interfere with sperm production, leading to male infertility. The condition may also cause testicular atrophy, shrinkage of the testicles due to reduced blood flow and oxygenation. Symptoms. Varicocele may be asymptomatic, but in many cases it causes noticeable symptoms, including 1. Scrotal swelling. The most common symptom is a visible or palpable mass in the scrotum, often described as feeling like a bag of worms due to the enlarged veins. 2. Testicular pain. Some men experience a dull ache or discomfort in the scrotum, especially after prolonged standing or physical activity. 3. Infertility. Varicocele is one of the leading causes of male infertility, as it can affect sperm production and quality. 4. Testicular atrophy. In severe cases, the affected testicle may shrink due to decreased blood flow. 5. Heaviness or discomfort. Some individuals report a sensation of heaviness or fullness in the scrotum. Diagnosis. The diagnosis of varicocele typically involves a combination of clinical examination and imaging studies. 1. Physical examination. A doctor may perform a physical exam by palpating the scrotum, especially when the patient is standing. Enlarged veins are often visible or palpable. 2. Ultrasound. A scrotal ultrasound is the gold standard for confirming the diagnosis. It can provide detailed images of the veins and help assess the size and degree of varicocele. Doppler ultrasound may also be used to evaluate blood flow. 3. Semen analysis. If infertility is suspected, a semen analysis can assess sperm count, motility, and morphology. 4. Venography. In rare cases, venography, a special imaging test that uses contrast dye to visualize veins, may be used to evaluate the veins in greater detail, though it is not typically required. Management and treatment. The management of varicocele depends on the severity of symptoms and the impact on fertility. 1. Observation. In cases where the varicocele is asymptomatic and not causing infertility, no immediate treatment may be necessary. Regular monitoring with physical exams and ultrasound may be sufficient. 2. Pain management. For individuals experiencing discomfort, over-the-counter pain relievers such as ibuprofen or acetaminophen can help manage symptoms. 3. Surgical intervention. Varicocelectomy. This is the most common surgical treatment for varicocele and involves the removal or ligation of the affected veins. It can be done through an open incision or using minimally invasive laparoscopic techniques. A varicocelectomy can improve sperm quality and alleviate symptoms, especially in men with infertility. Embolization. A non-surgical alternative is varicocele embolization, a minimally invasive procedure in which a catheter is inserted into the affected veins to block blood flow and reduce vein dilation. This method has a lower risk of complications and requires less recovery time than surgery. 4. Fertility treatment. If varicocele is affecting fertility, treatment options such as in vitro fertilization (IVF) or intracytoplasmic sperm injection (ICSI) may be recommended, especially if sperm quality does not improve after surgery. 5. Hormonal therapy. In some cases, hormonal treatments may be used to improve sperm production, though this is less common. Case study. Case 1. A 28-year-old male with varicocele and infertility. Presentation. A 28-year-old male presents with complaints of persistent left scrotal swelling and a dull ache that worsens after prolonged physical activity. He has been trying to conceive with his partner for over a year without success. Physical examination reveals a palpable, irregular mass in the left scrotum, consistent with varicocele. Diagnosis. A scrotal ultrasound confirms the presence of a left-sided varicocele with dilated veins in the pampiniform plexus. Semen analysis shows a reduced sperm count and motility, indicating a potential impact on fertility. Management. Given the patient's fertility concerns and symptoms, the decision is made to proceed with surgical intervention. The patient undergoes a left varicocelectomy. Post-surgery, the patient is advised to refrain from heavy physical activity for a few weeks. Follow-up semen analysis is performed 6 months later, showing improvement in sperm count and motility. Outcome. The patient's fertility improves after surgery, and he and his partner successfully conceive naturally within a year. The scrotal swelling and discomfort are also resolved post-surgery.